I should also mention things that can reduce your levels of baseline dopamine. One that is rarely discussed is melatonin. I have talked before on this podcast about melatonin, why I am not a fan of using melatonin in order to enhance sleep. It can help one get to sleep, but not stay asleep. Dr. Matt Walker, sleep expert from University of California, Berkeley. I don't want to put words in his mouth, but in our discussion about melatonin on this podcast, when Matt was a guest, and in his book and on other podcasts, Matt has generally stated that the use of melatonin, except for treatment of jet lag, is generally not a good idea. And I agree. I think that melatonin is not often thought about as impacting the dopamine pathway, but there's at least one study published in 2001. First author is Nishiyama, just as it sounds. It's spelled just as it sounds. Acute effects of melatonin administration on cardiovascular autonomic regulation in healthy men. So the study wasn't specifically about dopamine, but they looked at norepinephrine and dopamine levels, and they found a statistically significant decrease in dopamine 60 minutes after melatonin administration. I've talked before about how viewing bright lights between the hours of 10 p.m. and 4 a.m. has been shown in studies by Dr. Samar Hattar, David Burson, excellent circadian scientists, to reduce levels of dopamine for several days after that light exposure. So dim the lights at night. If you can, avoid exogenous melatonin, meaning if you don't have to take melatonin and you can find a better alternative, that would be a good idea if you want to maintain healthy levels of dopamine.